So after this session by Dr. Alpana, I would like to invite Professor Rajarshi Kar. He is a professor of biochemistry and an active contributor to MU sessions also. Dr. Rajarshi will be taking you through the material and method section of your thesis protocol. This method section is one of the key components of your thesis protocol, because whatever you commit in your methods, that is what you have to do. So that is a main plan that you will be doing it. So over to you, Dr. Rajarshi, for this session.
Thank you. Thank you, Dr. Amir, and I'll be taking you to through the material and methods, like how to write the material and methods. I hope my slides are visible.
Yes, very much visible.
So this is basically the last part which you'll be writing in your protocol. So first it starts with the introduction, then you have the review of literature, then you have aim and objectives, and then you end it with the material and methods. And when you write the thesis, your thesis, when you completed the work, then you add on the results and discussion. And obviously after this, there will be the reference section, which will be taken up tomorrow. So the objective of this session, this session is that by the end of the session, you'll be able to know what all things you should include in material and methods, how you should arrange those materials or those information in your material and methods, and what all things you should not include in the material and methods. So first of all, the material and methods section would start with the basic information like the place of study. So here you have to write where the study will be carried out. So in this case, for your case, it will obviously be UCMS and GTB hospital, and also mention the departments which are involved, like your primary department and the department from where you have your co-supervisor or part of the thesis, like the experimental work is being done in biochemistry, and you are from the gynecology department. So you write in the department of gynecology and obstetrics and biochemistry of UCMS and GTB hospital. Then you mention the duration of period, like from when, which time to which time. So when you submit your protocol and when you are due for your thesis submission, so that will be your duration of your study. Then you have to mention your type of study. So the study design basically, which will be the next session, which will be taken by Dr. Kiran. And then you'll have to write about the ethical part. So that also is an important thing. So if you are doing a human if your research is on human subjects, then you'll have to take ethical permission from the institutional ethical committee for human research. And if it is on animal studies, then from the animal research ethical committee, you have to take, and you have to mention it that this has been taken and informed consent has been signed by the patients who have been included in the study. So this is an example, as I said. So the Department of Obstetrics and Gynecology, Biochemistry, Pathology, this is the place of the study. Then you mention the study design, duration of the study, and then you write about the ethical part. Then we come to the PICO, the population, intervention, comparator or control, and the outcome. So in the population, you'll have to mention the sample size and the basis, how you have calculated this sample size, like what is the study population. So that should be your opening statement in this, and how you have calculated. So in some protocol or in some thesis, you'll find that this has been included in the statistics section, which will come in the later part, and some prefer to put it in the beginning. So I personally prefer to put it in the beginning, like how you have arrived at that sample size. Then obviously where the patients will be recruited, it will be recruited in the OPD, gynae OPD or medicine OPD, or you'll go out in the community and recruit the patients. and then how you will do the sampling. Like if you have a case control study, how your cases will be defined. So you have to define the case first. And by defining the case, you will automatically define the inclusion criteria. So what all criteria, if the subject fits into, you will include them in the study. So it can be the age, there can be an age limit, or a criteria for defining the disease condition. Like if you are studying on hypertension, then what should be the blood pressure? Like systolic blood pressure above 140 you will take. Or if you are taking the control group, they also should have an inclusion criteria. Like if it is healthy controls, you have to mention that healthy controls not having this disease which you are studying. Then you have to also mention the exclusion criteria. So here most people make a mistake is that they write the opposite of inclusion criteria. Like if you say that we'll include subjects over age 20, and then in the exclusion criteria, if you say that those who are below 20 years of age, I'll exclude. So that is not actually an exclusion criteria. The exclusion criteria is defined that subjects who actually fulfill the inclusion criteria. So they have to be of that age group which you are taking, and they must be having that disease condition. So it is not the absence of disease, you will not call it as an exclusion criteria. So they have to fulfill the inclusion criteria, and then they also have some additional condition which can possibly introduce a bias. So in that condition, you have to exclude, even though they are fit to be included in your study, like they fit the criteria, the definition of the study population you have defined, they fit that, but due to some additional conditions they are having, which may affect the results of the study, you are excluding them. So that is the exclusion criteria which you need to define. So based on this knowledge, now let us see if you can. I'll give a Google form in the chat box. So please attempt this and let me see if you have understood the difference between inclusion and exclusion criteria. Is the Google form visible to all of you?
Yes,
Yes,
the Google form is there in the chat box. I can see it. We can click it.
I haven't received any response yet, so while waiting for the responses, which you can see here.
Yes, wait for a few seconds. They will be clicking on it and it will take some time to open on their device, read it and click on it.
So I have only 24 responses till now. So 54% have said it's subjects who are on corticosteroids. So the 32% have said female patients diagnosed with diabetes, and there are some who thinks that subject with fasting plasma glucose value is less than 126 milligram per dl. So can any one of you volunteer to tell me why the majority is correct? Anyone? Yes, who has raised the hand?
Dr. Sangya Chaudhary raised her hand. Dr. Sangya, please.
Can you
Yes, sir.
please?
Sir, the majority is correct because, like, as you mentioned in the previous slide, that it should be the exclusion criteria should not be including the people who are already a part in the inclusion criteria. So, in the inclusion criteria, we've already chosen the males who are more than 20 years and have a fasting plasma glucose more than 126. So, those will be a subject in any case. We will exclude those out of them who will be on corticosteroid therapy.
Yeah, so they have to fulfill this criteria: 20 years of more than 20 years of age, male, and having a fasting plasma glucose of more than 126 milligram per dl. So after fulfilling this, now if they are on corticosteroids, since we are studying, it's obvious that we'll be studying on diabetes on this, so that may be a confounding factor or may affect the results. So we are adding this as an exclusion criteria. Now subjects less than 20 years, obviously they are not fulfilling the inclusion criteria, so this cannot be an exclusion criteria. Similarly, the second point, where it is less than 126 milligram per dl, it doesn't again fulfill. Female patient doesn't fulfill the inclusion criteria because it's male, so it cannot be an exclusion criteria. Thank you. And then in this also you have to, if you are doing a randomized control trial, so that again will be taken up in the next session as a study design. So here also you will have to mention how you have done the randomization. Like if you are doing a control, if you are doing a drug trial, and if you are giving a drug to a group and placebo to another group, so how you decide whether it is to whom you are giving the drug and whom you are giving the placebo. So that is usually blinded. Like the person who is administering doesn't know. It is randomized by a means of a table or some computer program, software program, which will tell you like this number is assigned to this patient in a particular sequence, and you do not know which patient is getting the drug and which patient is getting the placebo. So if you are doing randomization, you have to mention, and if you are not doing randomization, and it is not proper to say that it is a randomized control trial, because that may affect the entire perspective of the study. So if you are not doing a randomization, you have to clearly mention that we are not doing the randomization. This is another example. So here also, can any one of you spot a error in the inclusion and exclusion criteria? This is from one of the Thesis protocol. So I just put it up, and now I have noticed that there is an error in the exclusion criteria. Please unmute yourself and tell me. Anyone volunteering? Okay, so here also we don't have time, so let me explain. So here the inclusion criteria mentions epithelial ovarian tumors. So obviously the exclusion criteria cannot be ovarian malignancy other than epithelial ovarian cancer. So this is an error. This should not be there because your inclusion criteria, it should be and it should fulfill the inclusion criteria that it should be an epithelial ovarian tumor. But then if it is a recurrent one, then you will not include. If it has already received chemotherapy, then you will not include. So this first one should not be there in the exclusion criteria. Then you move on to describe what kind of intervention or procedure you will be following. So depending upon your study design, your intervention or procedure may be a diagnostic one. Suppose you are comparing ultrasound with CT for diagnosing appendicitis, or you are in ultrasound also you are per abdominal or TVS you are comparing to diagnose an ovarian tumor which more sensitivity specificity. So it can be a diagnostic. Most of the thesis will be observational where you have a case and a control group and you study certain parameters. So it is you are not intervening in the patient, or you are not giving any intervention, but you are just observing what is the difference between the two groups. Sometimes it can be interventional, which is very rare in MD thesis, like a drug trial is not usually done. But sometimes we actually do, like if it is it can be preventive, like you can administer some vitamin and see, follow up the patient whether that vitamin has an, like the example you saw in myocardial infarction, the particular diet, a DASH diet, and whether it is reducing the incidence of intervention, but that is very difficult in a time-bound MD thesis, so we usually don't do that. And therapeutic is when you give a drug A and drug B, you are comparing, so you are giving a therapeutic. Or if it is in the surgical field, so you are doing two methods of surgery, you are comparing which is better. So that can bring out a difference. So depending upon what is your study design, you will have to describe the procedure. So when you are describing the procedure, if it is a new method you are introducing for the first time, you'll have to describe it in detail. Or if it has already been done by someone and you are doing that method, then you can quote the reference. But it is always advisable that even if you give the reference of that method, like in case of biochemistry, I can say that the real-time PCR will be done following the method described by so and so et al. And then you give the year in which that study was published, and you mention that in your references. So if that reference is easily available online, then you may not describe it in detail. But most of the time it is not available so easily. So it's better that even if you are giving the reference, you describe it in detail. So basically you have to keep in mind that in material and methods, you have to write it in such a way that when someone picks up your protocol and tries to replicate your study, he should be able to do it without referring to anything else. So that should be the details you need to mention. Then if you are using a standard reference method and you are doing some modifications to it, like for example, you have changed the incubation period, or you have brought down, you have used a certain different instrument to do a surgery than described in the reference method, then those modifications you have to clearly mention. Then in case of experimental work, how much volume of sample you will take, 5 ml, what will be the incubation time in case of experiments. So in case, suppose you are doing an ELISA, so what will be the incubation time? All these things, concentration should be given to the last detail so that there is no confusion and anyone who tries to do that experiment can do it. And also what instrument or what machine you are using to do those observations or do those experiments, that you have to write the manufacturer's name and the details. So for example, if it is a real-time PCR machine, so you have to write, say it's Corbett and USA from where it has been manufactured. Then you will also have to mention that who will do the assessment. Like if you are suppose some part of your thesis, you have to go to somewhere else and get the assessment done. Like for example, if you do not have atomic absorption spectrophotometry in UCMS, you need to go to DU and do that. You'll have to say that this will be done at that place, and this will be the person who will be doing that for this thesis. Then also you'll have to mention if you are using some questionnaires or focus group discussion guides or observation recording form to collect data. So that also has to be attached to your protocol as an annexure. Then if you're doing an intervention, you'll have to mention like how frequently you will do that intervention. For example, suppose you are given a drug, now you have to measure its effect on blood pressure. So how frequently and at what interval you will take the blood pressure, that you will have to mention clearly. Then or you will have to do an ultrasound, then again examination or particular investigation, how many times you will take the blood sample. All these things have to be clearly written so that there is no ambiguity. And of course, if it is a drug trial, then what dose you will do, what will be the formulation, like what will be the vehicle in which that drug will be given. So it is also applicable in case of in vitro studies, like if you are doing studies on cell lines, then and you are giving some treatment. So what will you dissolve that drug and give it in that cell line? Or if you are doing an animal study and injecting it in the rats or mice, so there also you have to clearly give an outline of what dose or how will you arrive at that dose. So suppose you have to first standardize and come at a particular dose, so that also you'll have to mention. And for what duration you will give that treatment. So if it is a human trial, what will be the withdrawal criteria? Like if you have certain findings, certain side effects, that you have to mention that if these side effects appear, then I'll withdraw that particular subject from the trial or reverse it to the other arm. So all this will be, you have to clearly spell out. So you will also have to define procedures to handle like protocol violators. So suppose you have given a drug. Suppose you are studying the effect of curcumin on cervical cancer. So curcumin is the active principle of haldi or turmeric. It is known to have anti-cancer. So suppose you are giving and you have told the patient that you will have to take two capsules in the morning and 2 capsules in the evening. So if they are not following it or they do not come for follow-up, then what will you do? Like how many times you try to contact that. So all those details has to be given. Then finally, the PICO, the outcome measures. So this is again of 2 types, as you know, the primary outcome measures, which has been described in the previous sessions, so that should be your focus. So you have to describe clearly like what you will be measuring. So suppose you have described the procedure, you have described that I will do real-time PCR. Now you have to actually explain that what are you measuring. So you will be measuring the RNA quantity, or if you are doing ultrasound, so what all parameters you will record. So those will be the outcome measures. And then from that, what all secondary outcome measures you can probably gain. So for example, if you are first doing a study on the carotid intimal thickness you are measuring. So and along with that, you are also doing the lipid profile. So those can be the secondary outcome measures, and then you see the correlation between that. And of course, it is always advisable that you have a flow diagram, which will actually be a summary. And just by looking at the flow diagram, whoever is examining a protocol or going through a protocol has a clear idea that what all things or how you will move ahead with the study. So it will be an organogram, like how starting from sample collection and the analysis and the outcome measures, it will give you a clear idea even with the statistical test tools you'll apply. So this is an example, like, so you have a case control study, which is studying the expression of lipoprotein lipase and lipoprotein C2 and the lipid profile. So you will have to clearly say that how much blood you will take, 5 ml blood for clotted blood for this estimation, 3 ml for RNA isolation, the plasma you will use for ELISA. So all these things you have to mention, and then you have to say what kind of statistical test you will. So, but just by looking at this chart, you have a fair idea of your material and methods section. Then comes the data management. So you'll have to mention like what kind of data tools you'll use, like what softwares. Suppose you are using an Excel to record your data, so you'll have to mention that, and what software you'll use for the statistical analysis. So that also you'll have to clearly spell out. So now you can see here there are two statements. So can any one of you volunteer and say which statement is more appropriate or looks better? You can put it in the chat box. Anyone, can you volunteer? I've got Sangya responding to B. Yes, that's correct. Ayesha also has responded and chosen the statement B. So you have to be precise. So you cannot give a generalized statement that I just use student t-test to compare between groups. So which parameter you will compare with what, and what statistical test you will apply. So that has to be clearly mentioned in your statistical analysis. So, and of course, there will be a session taken by Dr. Amir tomorrow about the sample size and the statistical. But feel free to take the help of the community medicine department for your statistical analysis and also the sample size calculation. Then also you'll have to specify the data management, as I said, that the data will be tabulated in Microsoft Excel sheet. All analysis will be performed by SPSS version 17 software. So whatever version of SPSS you are using or any other statistical tool you are using, that you have to mention. Now coming to the things to avoid, you'll have to you should avoid discussing the merits and demerits of a method, and also you do not unnecessarily use too many methods to measure the same thing. For example, if you want to see the expression of a particular protein, so you can either do ELISA or a Western blot. So there's no point in doing both ELISA and Western blot to see the expression of a protein. Or if you want to measure the size of a tumor, which you can do by ultrasound, so you are doing ultrasound also and also a CT scan to measure the size. So that is again not advisable. You should also avoid using slang or jargon in the it applies to the entire protocol and thesis actually. And the most important thing is using the wrong tense. So what happens is that you sometimes your some method which you are using has already been done by your senior in his thesis, and you just copy his methodology section from his thesis. So remember that in thesis, it will be written in past tense that this was done. This experiment was done, or this measurement was done, or this method was followed. So everything is in past tense. But since you are writing a protocol, it will be in future tense. So you'll have to write this will be done. So you'll have to you should not, first of all, you should not copy paste from your seniors. You should write it in your own words and pay attention to the tense. And this also applies when you are writing your thesis after you have completed your work. So suppose you have done your protocol, if you have written your material methods meticulously during the protocol, so that is the section which will be least changed in your thesis. So you can copy paste, but there again you have to take care that you change the tense. If any part remains, that looks very bad on your thesis. So you pay good amount of attention to the tense you are using while writing material methods. And certain advices I would like to say is that even though it is mentioned that you cannot change your protocol, so the material and method section while writing, you have to take care that there may be some modifications down the line. So these are practical problems which you may face. For example, if you have said that I'll be doing ELISA, so you mention a particular kit, and then you have collected a sample, and at the end of 1.5 years, when you want to analyze, you are trying to order that kit. That kit has been withdrawn from the market, so some other kit is coming. So it's always better to leave those areas open-ended. Like I'll do ELISA. So ELISA you are following, but now you do not mention what kit you are using. So it can be a sandwich ELISA or a direct ELISA. The same thing applies for any other method which you are doing. So that will be again left to your judgment and your supervisor's judgment, that how much detail you will go into the methods, because you may have to do certain modification and adjustment down the line. And you never use approximate values. It's better that you either you do not go into the values if you are not sure, or if you want to put the values, then you should be accurate with it. So the checklist, this is the summary. So you can see on the left that it's PICO, population intervention comparator and outcome. You can take a snapshot of this. You have to check that these things have been included in your material and methods. So we have already discussed all this, so I'm not going into the details. So this you can take a snapshot and you can keep it as a ready reference while you're writing on it. Thank you. Is there time for questions?
Yeah, thank you, Dr. Rajarshi, for taking us through this material and method section. If the students would have questions, we will revert back to you. This was an interactive session, and most of the points have been clarified. Dr. Rajarshi, if you allow, as I showed in the last presentation, I would like to share this one of the method section from our protocols.
Yeah, sure. Thank you, Dr.
So this is one of the protocols that I shared with you. So let me share this. So all the PG students, you can see, as Dr. Rajarshi mentioned, this is how a real protocol finally looks like. It will differ obviously from context to context, but the broad outline will be same. So first part, when we start study setting, as Dr. Rajarshi mentioned, the place of study, what's the duration, what is the design of study, that will be discussed. This design of the study, it will be discussed in the next session by Dr. Dheeraj. So then study population, inclusion criteria, exclusion criteria, sample size, sampling technique, data collection, how will be done, study tools, what are the questionnaire that will be used, what are the definitions that are used in this study that you can give with references, or if you want to have your own definition for the purpose of your study, you can do that. Then outcome measures, then data management and statistical analysis that we'll be discussing tomorrow, and ethical considerations that also we will be discussing tomorrow. So this is how, and then we go on to the next. This is ethics form, and so this is how a method section would look like.
Thank you, Dr. Amit, for sharing.
Yeah, I will stop sharing my screen now.